Thank you all. First off, I really want to thank the Ocular Melanoma Foundation for having me, and to Dr. Singh, of course, for inviting me to come and talk. Couple disclosures really quickly. Number one, I pace. What that means is I'll be moving around. It also means that I'm likely going to be interactive. And when I say likely, it means definitely. How many of y'all have ever talked with a psychiatrist before? You don't have to raise your hand. You just can think it to yourself. So you know. Married to one. Me too. My poor husband. So, oh, I forgot the clicker. The other thing is I have a little bit of a cold, so I'll be grabbing my tissues as needed. So, oh, here's a clicker. I found it. So yeah, so I am a psychiatrist. And a lot of times people ask me questions like, what is a psychiatrist? Anybody know? Other than somebody who likes to pace around. Sir, you're married to one. Go ahead.
Well, you know, the big question between psychiatrists and psychologists, that's the big difference. So psychologists and psychiatrists both can do psychotherapies. However, psychiatrists are medical doctors. Right. They can also prescribe medication for activity.
Absolutely. So the quick difference is that psychiatrists are physicians, and instead of deciding to become oncologists or ophthalmologists, which are all really great fields as well, they're not as much fun as brain chemistry. No offense. It just isn't. And so psychiatrists go into the fun aspects of brain chemistry, whereas psychologists do psychotherapy, which is talk therapy. Psychiatrists do focus a lot on medicines, and that's something that gets a lot of debate within media in general. I'm not going to talk about that, though. What we are going to talk about, though, is living with uncertainty. We're going to talk about the rates of depression and anxiety in people who have cancer. We're going to talk a little bit about coping with cancer in general and with ocular melanoma, okay? So what I'm going to talk about today are ways of coping, how to advocate for your care, because that's something that studies have shown can be very helpful for people in managing their illness and finding ways to cope. And then, as I mentioned, again, the psychiatry part, I'm going to talk about depression and anxiety, as well as talking a little bit about fatigue. That's something that's pretty universal for people with cancer and treatment of cancer. Okay? Any questions? Anything else that you guys want me to cover? Because I can add in. Going once. All right. All right, so quality of life. So the Collaborative Ocular Melanoma Study. So first of all, as Mark eloquently put, ocular melanoma is a rare cancer. You guys know that. So there aren't a ton of studies out there on quality of life. And so what they found was the largest impact on quality of life, and who knows what I mean by quality of life?
How you enjoy your daily life and your activities, how comfortable they feel to you.
Absolutely. How you enjoy your daily activities. Exactly. It's how you're able to do the things you love doing after your diagnosis and after your treatment. And so what this study found is that for people with ocular melanoma, and this makes a lot of sense, right, that people had the greatest impairment in quality of life in things that required their vision to be intact, right? So issues with driving, issues with close vision, and issues where you need that sort of spatial, help me out, Dr. Singh.
Depth perception.
Depth perception, thanks. Again, I'm a psychiatrist.
Walking down steps at night.
Walking down steps at night, great example. So all of those things. So how about other factors that they found in this collaborative ocular melanoma study. There's another collaborative oncology study. I'm going to keep miscalling this study. The other thing that they found was that anxiety really dropped after the treatment. And so that was really an important thing for them to find. Although the one thing that they found that was interesting is that for patients who had enucleation, it was more likely that their anxiety resolved compared to those that had the brachytherapy. So although the anxiety would decrease, it didn't fully resolve. Okay? A couple other studies. And I just want to compare and contrast this for the general cancer studies, okay? So cancer in general, so when we talk about cancer, all cancers, lump them all together. In general, the rates of depression and anxiety is about 25%. We know that. So cancer regardless of location, okay? What we know for our ocular melanoma, like I said, there's not a ton of studies, but what the studies have found is that the rates are pretty comparable. So the rates of depression is about 27%. Wait, I think I just did it wrong. The rate of anxiety is 27%, and the rate of depression is 23%. I try and do it backwards. See if you guys are actually looking at the slides or not. And the highest rate of depression was found at 3 months following treatment in one of the studies, okay? But again, there's not a lot of studies. Although one of the studies I want to tell you guys about is a study that Dr. Singh and I did here at the Cleveland Clinic. And this was a study where we looked at depression and anxiety along with another outcome. And we looked at before treatment, at 3 months, and at a year out. And what we found is very similar to what other studies have found, is that anxiety really does drop over time. And as you can imagine, anxiety is going to be highest before treatment, right? Because you don't know what to expect. You've just been told about this illness that you probably had never heard of before, right? And so if you see, almost 50% of our sample had anxiety right before treatment. That dropped. At 1 year, that was down to 20%. Depression, on the other hand, our sample was low. Our sample had a lower rate of depression compared to what was in the literature. Our sample size was small. I can't fully explain why our numbers aren't comparable to the rest of the literature. So what are good ways to cope with cancer? What is coping? I feel like this side of the room has answered a lot. This side.
And how to deal with it? Yeah.
How you deal with things. Yes. Absolutely. Middle section, want to add anything?
To continue, just to keep going, to continue with your life and your activities.
Absolutely. To continue with your life and with your activities. Spirituality, absolutely. That's one of the coping mechanisms a lot of people will use. So coping is finding ways to manage the stress that you're having, right? It's being able to enjoy the things that you've always enjoyed your whole life, despite limitations that your illness has brought on, right? And finding ways to deal with uncertainty. That's one of the drawbacks of illnesses, is nobody knows what's necessarily going to happen next. No matter how brilliant your doctors are, how wonderful they are, because they're not always going to know what's going to happen. And managing the main symptoms of your illness. So that's what we talk about when we talk about effective coping of cancer, okay? So quick perspective. Everyone in this room has developed their own coping mechanisms, right? Everyone here has had stress before. And so what works for me to cope with stress isn't going to work for anybody else. So, for someone to say to someone going through cancer, oh, you should do X, Y, and Z, that may be very well intentioned, right? but it may not work for the person going through treatment. How many people here have heard if you have a good mood or if you have a positive viewpoint, your outcome will be better? How many people think that's true? Okay. So you guys know where that came from? Anybody? Our mothers. Well, I'm a mom, so I'm a soccer mom, so possibly. No, actually, some of that came from studies done in the 1980s. So there were some studies done in the 1980s that showed that if you had a positive attitude, your outcome from cancer, and these were breast cancer studies, was better. Anyone want to know what happened in the 1990s? All of those studies were disproven. Every single one of them. So what am I saying?
I think the author had bipolar disorder.
No, the author did not have bipolar disorder. But I like your thought process, Dr. Singh. No, yes.
If you've got a good attitude, at least you're enjoying it.
Absolutely. If you have a good attitude, what we know is that you cope better with the illness. But what I'm suggesting is that if you've been a pessimist your entire life, right in the midst of a serious medical illness is not the moment to switch your coping mechanisms. Nope. It isn't. You're going to be frustrated. Your family's not going to know what to do with you. It's not going to work out well. Trust me. So again, what's worked for you in the past, it's going to work for you in the future. And you want to go with the healthiest coping mechanisms that you've got. So what do I mean by healthy coping strategies? Right. I don't want you guys using unhealthy coping strategies. Very good. And so I've heard a couple people shout it out. No alcohol, preferably. No drugs. Yes, I'm still a doctor, so I'm going to say all of those things. Medical marijuana. I live in the state of Ohio. We don't have medical marijuana. You think? I don't know if anyone's looked at issue 2. I don't think it's going to pass. So as with any serious medical illness, being diagnosed with cancer is going to bring a lot of changes. So there can be changes to your daily routine. There can be coming and dealing with doctors all the time. And as lovely and wonderful as doctors are, coming and hanging out in a medical environment that a lot of people just aren't familiar with, it's not as much fun as one would anticipate. Having anxiety and fears about this, feeling down, having fatigue, new medicines, treatments, learning about a new illness. So the early days of diagnosis, this is what I hear from a lot of people. Initially, they have this feeling of shock and just being overwhelmed. You know, a lot of times people say, I didn't feel bad. For people with ocular melanoma, they say, you know, I was doing fine, and then one day, my vision wasn't so great. Didn't think it was going to be something this serious. Worry, what does the future hold? What does this mean? They'd never heard of ocular melanoma. And then betrayal and anger. I hear this from a lot of people. You know, how could my body have failed me? So after the diagnosis is sunk in, most people are able to cope with things the way that they used to. And what we see a lot of times is the support system, the family members really having a hard time at that point. However, for a group of people, they do feel like they're not able to move forward and do start moving into what we call major depression or clinical depression. So other typical reactions can include upheavals and adjusting to what people like to call the new normal or the new reality, depending on who you are. I have patients that really get upset when the term new normal is used. There can be times when you're coasting and things are going well. But overall, there can be a lot of unpredictability. Sorry. I'm going to go to a cough drop now. So here's some tips to cope with the illness. So taking things one day at a time, that can be something that can be very helpful. Having what we call realistic optimism, so looking forward to things. Managing your stress levels, keeping things in balance, working with your healthcare team, accepting your feelings, and then, when you need help, asking for it. A lot of people have a hard time asking for help and view it as a sign of weakness. And that's not really the case. So control what you can and recognize that there's a lot of things you don't control, okay? So things you don't control include your feelings, so your fear of the symptoms, the disease, or dying, the biological effects of the disease, and other people, right? You don't control other people. Although I kind of don't want the husbands in the room to hear that. I thought that was funny. So what you do control are your own health behaviors and how you respond to the feelings, okay? So you do have control over quite a bit of things. So healthy coping. We talk about a lot of things, and we've talked a lot about the emotional things. There's a lot of things physically that physicians will talk a lot about. So nutrition, exercise, beating fatigue, all those things. There's definitely an overlap. How many people do relaxation techniques regularly? Oh, man. That wasn't nearly enough people. Everyone should be doing relaxation techniques regularly. It should be like brushing your teeth. It's really something that in psychiatry we think is pretty critically important. It's good to try a few and find out what works for you. I think it's really ideal if you find one that you like that can be done in any location. And I typically have my patients start with something really easy, and then I tell them to practice and practice, practice and practice. I give my patients a lot of homework. So some of the really quick and easy ones are breathing exercises. How many people have tried breathing exercises? They're really easy. Everybody knows how to breathe, right? I mean, I learned in med school, everybody knows how to breathe. It's pretty easy. And it's something that you can do anywhere. So if you have to go in for scans and you're feeling anxious, because going in for scans can be anxiety provoking, you can do some breathing exercises to help you calm down. If you're going in for lab work and you're feeling anxious, you can do breathing exercises. It's something that people don't really necessarily notice you doing. And there's a million different ways to do breathing exercises. But ultimately, it's very simple. You breathe slowly. So I want everybody here to try it. So you're just going to, poor Dr. Singh, you too. All right, you're just going to take in a deep breath, and then you're going to hold it for a couple seconds, and then you're going to exhale. All right, how was it? It wasn't hard, right? So what happens is when people start feeling anxious, they start breathing faster. When we start breathing faster, unfortunately what happens is a bunch of different things, but it ends up snowballing. And breathing can help break that cycle, doing some deep breathing. And so that's why it's one of my favorites. Progressive muscle relaxation. Who knows what that is? Right. I like progressive muscle relaxation exactly for that reason, because you can see what you're doing. So you're tensing muscles really, really tight, and then you're relaxing them. And then guided visualization is another good quick relaxation exercise. Okay, so how should you advocate for the best care in an environment that a lot of people just really aren't very familiar with? So we talk about this term, powerful patient. Have you guys heard that term like a million times already? So start with the right treatment team. I always think that's really important. Know what works best for you. Are you somebody who likes a lot of information or not a lot of information? What kind of communication style do you like? And getting a second opinion can be very helpful for a lot of people. So this is one of my favorite cartoons, and so I'll just read it because I don't know if you guys can read it. Oh my, yes, I know all about cancer. Much like tourists, you're deeply emotional and intuitive. And your top concern is family, something of a homebody you prefer to stay in rather than go out on the town. You can be moody, drawing into your protective shell, and if things get too intense around you, blah, blah, blah. While his doctor knew a lot, Gary decided to find a specialist anyway. And so I do talk a lot with patients and families who have rare cancers. And I do think that getting an opinion from someone who's a specialist in that field makes a lot of sense. Because while you may love your oncologist back at home, who's only seen 2 cases in their entire career, it behooves you to see someone to get that extra opinion. So some of the tips that I really like that my patients will do is to write down questions before, during, after the appointments, and have it in a binder. Just bring it all in with you. Coming up with a health plan, I think, can be very helpful. Asking about treatment options, and getting a mentor or joining a support network. Those things can also really help people in coming up with how they want their treatment to go and what's going to be the right treatment team for them. So let me see where I'm at time-wise. All right, so fatigue, I'm going to talk about really quickly because I want to leave time for questions and answers. Right? So fatigue is a persistent symptom. It's a subjective feeling of tiredness or exhaustion. It's related to the cancer treatment. What we know is fatigue is very much underreported and oftentimes goes untreated for a variety of reasons. And so what we know is that it's undertreated from the physician standpoint, and there's a lot of studies on this, because doctors many times don't know how to treat it. And they underestimate the impact on quality of life. And a lot of times patients don't bring it up because they just assume it's a side effect from treatment or the illness. And they also are concerned that if they bring it up, they won't get aggressive treatment. Lots of causes. Yes?
If they bring it up to their physician, they have a fear that that physician will not treat them as aggressively.
Yes.
I don't see how that correlates with the person's mind.
That's what the studies have shown.
It is worried that the doctor will think they don't have the energy to be able to get through a certain treatment. That, if someone's getting a surgery, and their health is really bad, you're not going to give them a surgery, they'll die on the table. So by analogy, it could be along those lines. That if they're already tired, maybe they'll pick a treatment that's going to reduce their energy a little bit less. And it might be more surgery. That's how I would.
In the first,
Right. this is in the patient's mind. And you know, when I get to depression, I don't have it split up like this, but in depression, we have the same studies. And again, these are general cancer studies. So this is all cancer types lumped together. And what we know in the depression studies is the same thing, is that patients won't tell their doctors that they're suffering from depression. And the reason they don't is because they're afraid that they won't get aggressive treatment. That they're afraid the doctor's going to say, you know what, if you're having fatigue and you're depressed, why would I give you aggressive treatment? In the culture that we live in, you know, we talk about being a warrior against cancer, that you're going to fight this cancer. And what we found in some of the newer studies is that patients are afraid to tell their doctors because they fear abandonment, which is a really unfortunate side effect of some of the things going on culturally, because we know that doctors aren't going to abandon their patients. That's simply not going to happen. And it's unfortunate that patients are having that perception of doctors. So lots of things can contribute to fatigue, but I'm just going to fly through some of these just because I'm running very short on time. Lots of treatments for fatigue, things like exercise, nutrition, sleep. What? What? Right, avoiding boring meetings. Sorry, I told you guys I'm flying through it. Exercise benefits, blah, blah. Everybody knows you should exercise. I'm a doctor. Nutrition, yeah, everybody should eat healthy. Told you guys I was a mom. Sleep, oh my goodness. Everybody should sleep really healthy. Everybody knows you shouldn't watch TV or play with your phone or read a book while you're in bed, right? Does everybody know that? There's only 2 things that should happen in bed, right? One of them is sleeping. And, huh?
If I'm ever fatigued, I wonder if it's old age.
You know, we can talk about that later. So there's different energy conservation strategies that a lot of people will use. So for people who have more energy in the mornings, you'll try and, you know, front load your day, you know, pacing activities versus burning through all your energy and then paying for it later. The studies show that either way, you're going to be able to do the equal amount. Pharmacologically, we do have some options. We have different medicines, so we have stimulants, and we have wakefulness promoting agents that have been quite beneficial. Some of the antidepressants can also be helpful. And then there have been some studies with complementary and alternative medicine that have shown some promise. So when is it depression? So for someone who's having 2 weeks or longer of a depressed mood or not enjoying things that they used to, along with problems with sleep, feelings of guilt, worsening fatigue, problems concentrating, changes in their appetite, feeling slowed up or sped up internally, and thoughts of wanting to die or killing themselves. That's when we start thinking this is now the illness major depression. The illness major depression has been associated with worse outcomes in cancer care. If someone is suffering from major depression, that is something your doctor needs to know about, because that's something that we can treat. Okay? Lots of different treatments for depression, medicine, psychotherapy. Anxiety can be a normal response to threat, uncertainty, and loss of control. It's very common in people with serious medical illnesses, especially at initial diagnosis and at crisis points. But it can also be mimicked by lots of different things, including medicines, pain, and lots of medical problems. Specific anxiety that I see that can prevent people from going through with treatment include things like needle phobia or claustrophobia. I have lots of people who are sent to me for evaluation who refuse to go and get scans. People will develop anticipatory anxiety, and we know the rates of PTSD are going up. Treatment of anxiety is basically the same as depression. So in summary, we know that people with ocular melanoma are at risk for anxiety and depression, ways of managing the stress, and make sure to recognize any symptoms of depression, anxiety, fatigue.